Hey folks, it is Friday. If it's Friday, it must be Ann. It's the very end of January. I'm having a really hard time wrapping my head around the fact that next week is going to be February. I think I'm staying in denial, but it is going to be February. And February is a fun month. I mean, there's Valentine's Day, it's Black History Month. Um, February is a good month to have. So I'm ready. Right on the heels of February comes March. And in March, we will be 1 year. Remember, we closed our offices on March the 16th, I think it was. I think the 15th was on a Sunday. So, wow, who knew? Next week, Lord willing and the creek don't rise, I am going to be spending much more time back in my office. Yay! Um, I will be well into my second week of having received my second COVID vaccine, which means I will be much closer to having 95% immunity. I'm really excited about this. I kind of feel like I have been freed and I will really enjoy being able to get back into some semblance of routine. Not 100% by any means. There's some things that I've learned that are just better done from home. A lot of these Zoom meetings will be continuing for quite a while, and I've got pretty good connectivity at home, and frankly, a lot more privacy, except for when the dogs decide to go crazy if the post person appears or what have you. But I think we're learning some new ways and some things that even when things get back to quote normal, um, that it'll be different. It'll be different. Um, it'll probably be even different with my hair. I cannot make my mind up of whether I want to go back to the hairdresser and decide to return to the dark brown color or see what she can do with this new platinum color. So I don't know. Things will be different though. Enough of that. Let's talk about COVID. Oh, joy. I know. um, all things COVID. So, good news, really good news, is our employee cases have really gone down quite a bit, along with our employee quarantine. So, y'all are doing a really good job out there. You're keeping your precautions out with your masking and your social distancing and hand washing and everything, and you're doing so even in your home environments and your community environments. So it is beginning to really make a difference. We can heave a sigh of relief. I don't want to get too comfortable because we still have a pandemic out there, but kudos to everyone. We're also seeing in the data that John Douglas does such a really good job of keeping us all abreast of. The data is beginning to give us a little bit of hope for what's coming up in the future in terms of have we reached a peak? Are things slowing down? Don't forget, though, even though things may be loosening and leveling up in our own environments, the hospital environments are still being heavily taxed. With the number of COVID admissions and the hospitalizations that are taking place. So we're not out of the woods yet, but things are making a lot of progress. Our monoclonal antibody infusion is well underway. We're having wonderful experience with that. The team over in Hartsville at Sweet Bee are doing a fantastic job. So remember that is a treatment that is targeted for those who have been already diagnosed or tested as positive and that are in a high risk category. If you wonder what that category is, you just need to touch base with the IV nurses because I certainly can't give you a good explanation. but older folks and those with comorbidities and a fragility, so to speak, in their medical conditions. You've got a short window, it's pretty quick. So the sooner the person knows the outcome on a test, the better. And oh, we're hearing really good things about that treatment, the difference that it is making with folks, keeping them both out of the hospital and having much, much less symptoms and uh, experience with having COVID. So remember that. It's a good thing. And we are one of the few ambulatory places across the state that is being able to offer this. So kudos to all the folks that worked hard to get that done. Let's talk a little bit about the vaccine. It has been a really extraordinary week in terms of vaccine development. Many of y'all were following along with some of this as it started transpiring. And it began with a decision that the DHEC Board of Directors, now that's a gubernatorial appointment into that Board of Directors, you made the decision on Tuesday that the priority for the vaccination was going to be urban centers, not rural. Well, that got us all up in our arm, and we were frankly aghast at that. So, a lot of work went on, a lot of begging and pleading, because for us, it meant that we were done taking appointments. We couldn't um, depend on the supply of the vaccine. So we figured we'd better stop while we were ahead and cut off appointments. That in turn had a domino effect as soon as that notice got out that, oh, no, no, CareSouth is stopping taking appointments for vaccinations. People realized, no, we don't want that to happen. And all of a sudden, we got 1,200 doses targeted for us next week. That's the first week in February that I'm talking about now. But the caveat on that was, could we target those 1,200 doses to Chesterfield County, Marlboro County, and Dillon County? And we said by all means. So we will be having a schedule next week of 3 days in Chesterfield. That would be Tuesday, Thursday, and Friday, along with 3 days in McCall, Marlboro County, also of those same days, Tuesday, Thursday, and Friday, and 2 days in Dillon County at our Latta site of Wednesday and Friday. These are going to be pretty big appointment opportunities, and the last I checked, we have appointments available. We don't have appointments available in any other of our locations, but in these locations we do have appointments available. So we're doing everything in our power to make sure that folks are aware of that and that we can get this vaccine out. I really have to pass on kudos, more than kudos, virtual hugs and everything to the team that pulled off this Herculean effort to get these clinics scheduled in these locations so that next week we're going to give out 1,200 vaccines. That is really going to be awesome. You know, vaccines in the rural areas is really quite important um, because we are in a hard to reach area. We're in a medically underserved area. We're in an area where not always is there a hospital like Marlboro and Lee counties. And sometimes Care South Carolina is it. We are the main provider of services. So making sure that the communities, the residents, the patients, our patients, and other patients have access to the vaccine is a number one priority. And we're going to do everything in our power to make that happen. We did give out 680 doses so far, not even counting today, of vaccines in our own settings. And that included 141 staff that we gave vaccines to. Now, if you add that to about the, I don't know, 70 or so vaccinations that our staff received at McLeod, we're pushing almost half of our staff being vaccinated. I'm one of those. I received my second dose, as I've already shared with everyone, and am so grateful that I'm well on the way to having my full 95% immunity. You are doing a great job on that. Um, and understand the vaccine is not having adverse consequences. We're not growing six fingers or anything like that. Uh, it's doing well. So for those of you who might be hesitating around, I don't know about the vaccine. I want to see how everybody else does. Every story that I have heard now, including my own experience, is that this is nothing to be afraid of, that we really need to be all vaccinated and get over this pandemic. Let things, and in Dr. Smith's word, we need to get back to a normal. Take a deep breath. So I really, really encourage you. If you've got any questions, talk to someone. Talk to someone who's had their own experience around the vaccine. Talk to a provider, your doctor, or nurse practitioner, and get yourself assured that this is a really safe and effective way to combat this virus. I'm going to pivot now briefly to other news. There is other news about what's going on at CareSouth. The eClinical Works, the new EHR, is going very well. We are now over 1 month past our go live date, which was the middle of December. Boy, does that feel like it was so long ago. I still and several others on our executive team also continue to have weekly meetings with our consultant partners, Blue Novo, and we're hearing some really good results. Y'all are learning rapidly. You're making a lot of improvements. You are adopting. You see some of the benefits and some of the value that ECW is making a difference. And we've still got some things to do. We've still got some integrations that still need to occur. Most notably, our Zara registry is still underway for its integration. So things are still in play and going on and in process. But overall, you've really done an amazing job. Keep in touch. Keep the team, the ECW implementation team, aware of what your needs are, and we're going to make sure that this goes smoothly. But so far, y'all have done an amazing job. I also want to close with some kudos to the value-based care team. You know, that's Dr. Duncan and her team. That are situated out of Society Hill and right now are able to do a lot of work from home. They have done an amazing job over 2020, job that has been recognized as a high performing job in many different scenarios. They have outperformed many other organizations in the state. We've gotten recognition about our high performance from many health plans. Blue Cross Blue Shield has recognized. We have improved in our star performance. That's kind of a complicated thing to understand. It's a weighted measure of a bunch of different things. Uh, we've been moved up in our star performance with many, many plans. So I really want everybody to understand that we are making good progress in value based care. Very targeted progress. So kudos to Dr. Duncan and Kelly Cross and all the team that is working so hard to accomplish this. Uh, we've talked so much about value-based care in the past that when COVID came around, it sort of took uh, the space up. But now we are beginning to get back on board and to realizing that even during a pandemic, we can make big and good progress in this. So keep up the work, value-based care team, and all of you who are contributing to that. We make a difference. You make a difference at Care South. And let's keep that up. Folks, have a good weekend. Be safe. Stay well. Don't wait. Get an immunization. Talk to you later. Bye bye.